too loud.
Hey, my name's Gina. I'm a student nurse.
Hi, Gina.
I have the same patient as you today.
Oh,
It's
good.
nice to meet you. I was wondering if you could give me S-bar on your patient.
Sure. So today we have Glenn Light. He's a 67-year-old male. He was admitted this morning with a diabetic ulcer on his right heel for 3 weeks. He has no known allergies. His code status is full code. I assessed the patient just now, and the vital signs are blood pressure is 128/70. The pulse is 76. Respiratory rate is 16. The patient is not on oxygen. He's on regular room air, so his SpO2 was 96. In the last 5 days, his blood sugar increased to the 300s, and that was abnormal for the patient, so he was concerned because the last 3 weeks it's been basically in the 120s. Upon my assessment, everything was unremarkable, except some neuropathy is present in both lower extremities bilaterally. Also, he has an IV in the right hand. The ulcer that we assessed is 5.5 by 2.5 centimeters, 3 centimeters deep. It has a pink wound base, no tunneling or undermining, and moderate serosanguineous fluid. Also, there was an increase in pain with the patient, so we administered morphine and we tried soaking, and it helped soaking the foot, but there was no relief. Also, he drinks 1 beer a day. He doesn't have any formal exercise except for he bowls on Fridays. And we just assessed the blood sugar, and it was 290.
Cool.
And also, the patient is now getting Lispro for his diabetes. It's a rapid-acting insulin. So since his blood sugar was 290, that's within the parameters for administering. So some recommendations that I have is we're going to turn the patient every 2 hours to avoid any more pressure ulcers. Also, we're going to give 6 units of insulin based on the patient's blood glucose and weight. Also, we want to kind of teach the client how to properly eat based on his diabetes. We want to monitor and assess the wound on the right heel to make sure there's no changes, that it's healing correctly. And we're going to monitor the blood glucose level after we administer the medication to make sure that the level drops. And we're going to monitor lab values like the bun, creatinine, and potassium, because we want to make sure that the patient has proper renal function and no signs of hypoglycemia.
Okay, cool. So why exactly are you giving him the medication?
Well, the patient is a type 1 diabetic, and with type 1 diabetes, your body doesn't produce insulin at all. Therefore, your blood sugar is not regulated.
Oh, okay. So what action does it have on the body?
This medication, it increases the uptake of glucose and inhibits the hepatic production of glucose also.
Okay, so when should you question administering the medication?
You want to question this if a patient is administering any signs of hypoglycemia like diaphoresis, cold and clammy skin, level confusion. Also, if the patient's blood sugar is greater than 300 or less than 70, we are going to call the PCP and withhold the medication until we talk to the doctor. Also, if the patient has not eaten or will refuse to eat.
Okay, so does the medication have a therapeutic serum level?
Not necessarily, but we want to make sure that the blood sugar is regulated between 70 and 120.
And what vital signs should be monitored?
All vital signs are important, but we want to focus on blood pressure and heart rate and also respiratory rate to make sure we don't have any hypoglycemia or signs of that.
Okay, and so are there other physiological parameters that should be monitored when the medication is administered?
Yes, so you want to assess the patient for signs of hypoglycemia, like I said before, diaphoresis, cold and clammy skin, confusion, also for allergic reactions such as anaphylaxis, urticaria, any swelling on the injection site.
Cool. So what interventions should be taught to the client to ensure the medication is administered safely in the hospital and at home?
Well, in the hospital, it's more controlled with the nurse there, but you also want to let the patient know to let the nurse know if they're not going to eat, if they're going to refuse the medication, if they feel nauseous or they're going to vomit. Also, we want to have them let us know what injection site they used previously, because when the nurse changes shifts, they might not know. And also at home, with the insulin, you want to make sure the patient checks the expiration date, that it's clear, not cloudy. They want to rotate their injection sites, make sure they check their blood sugar, that it's within the parameters for administration. Contact their primary care provider with any new medications. And that's basically what you do at home.
Cool. Are there side effects and potential adverse reactions? What are those?
Yes. So they're primarily hypoglycemia, and like all of the signs and symptoms I said before, and also anaphylaxis is the primary allergic reaction.
Okay. And how you know the medication is effective?
We'll know it's effective when the blood sugar drops and it's between 70 and 120.
Oh, okay. Cool. Well, so you ready to go give this medication?
Yes.
Let's do it.
All right.
Knock, knock.
This is Pam. Pam's a student nurse. If it's okay with you, she's going to come in and observe. Yes. Okay, great. Perfect. So.
Knock, knock, knock.
Hello.
Hello, how are you?
Very well. How are you?
Good. I'm Brianna. I'll be,
You're plugged in. You can unplug it.
I'm Brianna. I'll be your nurse today. How are you?
Very well.
Can you state your name and date of birth for me?
Sure. It's going to be Glenn Light, 67.
No air bubbles.
Whoops. Okay. So where were we? You were washing your hands?
Yes.
All
All right, so we're gonna
Could you go ahead
check
and
the
double check the
fibroids
air
here.
is at 18?
So state your name and date of birth for me again.
Yeah, it's going to be Glenn Light, 67-year-old.
Okay, so we have, we want to make sure we have the right drug, which is Lispro, the right route, which is subcutaneous, the right medication time. So right now it is 4:30, and they had it for 5 o'clock. So we're within that hour, which is good. Also, you want to have the right patient, which we checked, the right drug and the right dose, and the dose is going to be 6 units based on the sliding scale.
Okay, Mr. Jarvis, any questions? You okay with this?
Yes.
Do that.
All right, so I'm just going to scan your armband quick, okay? And any allergies that you know of?
No, ma'am.
Any allergic reactions to any insulin that you've had?
No, ma'am.
5, 6, 7, 800 times if I can, you know what I'm saying?
Okay.
Yeah.
Let me see your armband there.
That's for sure. Okay.
Okay.
We're going to go into the 90-degree angle. You ready? 1, 2, 3. Stabilize.
I'm just going to do that one more time.
Sure.
Okay, and that's going to go right in the sharp spots. Okay? How was that?
All right.
Anything? Good? All
We're going to
right.
get out our Lispro,
Clean up.
which we have here, and get it out of the syringe. Now at this time, we're going to check again our fibroids, make sure they're the right patient, right route, right time, right dose, and right drug, which we do, checking everything here.
Okay.
So before we
I'm going to
administer
go
the
ahead and
medication,
document all this.
we are going to,
And while we're doing that, Pam, would you like to step outside and discuss what we did today?
rub our alcohol on the bottom. And we're going to administer 6 units of air first.
There we go.
And then we're going to take out 6 units.
Okay, so let's step outside here, and you need anything else?
And at this point, we would do our third check. Right patient, state your name and date of birth for me.
Glenn Light, 67 years old.
All right, and we're going to administer sub-Q, the right time, so 4:30, and the right drug, we have Lispro, and 6 units.
In the next few minutes that you ring that
So
bell.
now we are going to
for about,
cleanse the site.
10 to 15 minutes, ring the bell and let me know, because I want to make sure you eat. You gave you that insulin, so you understand that it brings your blood sugar down, so you have to eat regularly.
Any pain right now, Mr. Light?
Nope.
You know, make everything equal, okay?
Gonna administer.
Blood sugar levels. I also printed some stuff out for you. I'm gonna go over it with you
Alright.
later. We're gonna learn a little bit more about the different medications you're taking.
Feeling okay after
Okay?
that?
All right, you need anything else at all? All right, well, thank you for letting my student come in.
All right, Mr. Light, I saw that you requested some material for education on your diet and the Lispro. So I'm going to give you some pamphlets on that, okay?
Okay.
Now with your diet, the main thing you want to focus on is limiting your carbs to 80 grams a meal. And also, I saw that you were limited to 2 grams of sodium a day. So you might want to make sure you're following that. Try to limit your alcohol intake to 1 drink a day. Try to stay away from it if you can. Okay? Try to eat more vegetables, nuts, whole grains. Try to eat all the good stuff. Okay?
Yes,
Any
ma'am.
questions?
Nope, you're
Okay.
great.
All right. And I'll be back to check on you, okay?
Sure.
All right.
Cool. cool. Thanks for showing me that.
Sure, anytime.
So were there any pertinent pieces of information you reviewed before administering the client's medication?
Yes, I looked at the blood glucose level, made sure it was in the parameters of administration. I also looked at the potassium level to make sure the patient was not hypokalemic, and I looked at the patient's vital signs to make sure everything was normal before I administered the medication.
Awesome. So the information, I guess it affected your decision to administer the medication?
Yes, if anything was abnormal or high-low range, then we wouldn't administer the medication.
And did it affect how you administered the medication?
No, because the only route for Lispro is sub-Q, so that's how we give the medication.
All right. Well, thanks so much.
You're welcome, thank you.
Bye.